Hi everyone, this is Dr. Bolad, board certified physician in cardiology, interventional cardiology, and internal medicine. Today, I will talk to you about coronavirus infection and heart attacks. A heart attack, medically known as acute coronary syndrome, also known as myocardial infarction, occurs when a part of the heart muscle doesn't get enough blood supply. This is a medical emergency, and the more time that passes without treatment to restore blood flow, the greater the damage to the heart. The main cause of heart attacks is disease or blockage in the main arteries of the heart, the coronary arteries. I spoke in a previous video that COVID-19 causes inflammation in the coronary arteries and leads to development of clots in these arteries, leading to increased incidence of heart attacks. In this video, I will talk about heart attacks in relation to the coronavirus of 2019, the COVID-19, and the latest information we have so far. Are all heart attacks the same? I get asked this question regularly by my patients. The short answer is that heart attacks are not the same. So, let's talk about the types of heart attacks. There are different types, and they are classified internationally by the universal definition of myocardial infarction. Currently, in its fourth version, which was updated in 2018. The table shown shows the 5 types of heart attack. For the sake of this presentation, I will talk about type 1 and type 2 myocardial infarction or heart attacks, as the majority of heart attacks caused by coronavirus, COVID-19, falls into these two categories. Type 1 heart attacks are caused by spontaneous break or ulceration in the inner lining of the main arteries of the heart. This leads to clot formation and blockage of blood flow carrying oxygen to the muscle of the heart. Type 2 heart attacks are caused by imbalance between supply of oxygenated blood to the muscle of the heart and the demand the heart needs. This imbalance can be caused by anemia, respiratory failure, low blood pressure, very high blood pressure, and other causes. Clinically, heart attacks are classified on how they show on the ECG tracing. If there is an elevation of the ST segment on the ECG, the heart attack is classified as ST elevation myocardial infarction, known for short as STEMI. If there is no ST elevation, then the heart attack is classified as non-ST elevation myocardial infarction, known for short as non-STEMI. In non-STEMI, heart attack is diagnosed by elevated markers from the heart, especially a marker known as troponin. What is the incidence of heart involvement in COVID-19 infection? COVID-19 virus, the SARS-CoV-2, enters the body through respiration. It then lodges in the lungs and affects multiple organs, importantly the heart, due to the abundance of ACE2 receptors, as I outlined before in my previous talks. It is thought that the incidence of heart involved in COVID-19 infection is high. In this context, I would like to refer to a German study published in the journal JAMA Cardiology in July of 2020, in which investigators studied 100 patients who were infected with COVID-19 between April and June of 2020 and were compared to healthy individuals. Heart marker troponin, blood levels, and cardiovascular magnetic resonance imaging were obtained. Comparisons were made with about a comparable number of uninfected volunteers. Of the 100 patients who recently recovered from COVID-19, 67% recovered at home while 33% required hospital admission. At the time of the imaging, the heart biomarkers were detected in the blood in 76% of patients, reflecting heart damage. This was also confirmed by the magnetic resonance imaging, showing 78% of patients had an abnormal finding, with 60% of patients having ongoing heart inflammation. This is really important, as it shows that although a person may recover from COVID-19 and be feeling better and thought to have recovered, that in fact there is still ongoing inflammation of the heart, which might lead to permanent heart damage. I have to point out that in this study, they did not elaborate on the ECG findings, and thus the incidence of heart attacks compared to primary muscle inflammation, that we label as myocarditis, is not clear. They did point out in the results that the second commonest finding in their study was a scar, and this is usually reflects muscle damage from the heart attack. Is there an increased incidence of heart death in COVID-19 infection? The answer is clearly yes. It has been shown in multiple studies. I would like to point out an Italian study published in June of 2020 in the European Society of Cardiology journal. The investigators looked into the association between the out-of-hospital cardiac arrests in 2019 before the COVID-19 pandemic and during the COVID-19 pandemic. The investigators included all the consecutive out-of-hospital cardiac arrests, which occurred in 4 provinces in Italy in the 2 months following the first documented case of COVID-19, and compared them with those which occurred in the same time frame in 2019. They found a strong and significant correlation between COVID-19 infection and the increased incidence of out-of-hospital cardiac arrests. I also have to point out that it is not clear whether the increased incidence was due to patients who had a heart attack or from primary inflammation of the muscle of the heart from direct infection by the virus. Is there an increased incidence of patients presenting to the hospital with acute heart attacks? The answer is surprisingly no, and it is due to the fact that patients are worried to present to hospitals fearing that they might get infected by the COVID-19 virus. This has been shown internationally in multiple studies from different countries. Unfortunately, if people delay presenting to the hospital and getting immediate treatment after sustaining an acute heart attack, permanent muscle damage to the heart would occur, which is not reversible, and the long-term survival would be reduced. Here are a few publications confirming the occurrence of this delay. If you have any of these symptoms, please call your emergency number immediately to get medical help. In acute heart attacks, every minute counts. The symptoms are pain or chest discomfort, lightheadedness, nausea or vomiting, jaw, neck or back pain, discomfort or pain in the arm or shoulder, acute shortness of breath. Please remember, every minute counts. Please call for help if you have any of the symptoms mentioned. Key points. There is an increased incidence of heart attacks in patients with COVID-19 infection. Heart attacks can present clinically as ST elevation myocardial infarction, STEMI, or non-ST elevation myocardial infarction, non-STEMI. There is ongoing damage to the heart even after apparent recovery from the COVID-19 infection. There is an increased incidence of out-of-hospital cardiac arrest and death in patients infected with COVID-19, likely related to either heart attacks or heart muscle inflammation. There is a delay in reporting to the emergency rooms in patients with symptoms of heart attack, and this is related to fear of getting infected with COVID-19 virus from the hospital. If you have symptoms of heart attack, then please call your emergency phone number immediately to get help. Remember, in an acute heart attack, every minute counts in saving your heart and your life.